Now, Target 12 in depth. You know, every Friday morning we check in with a member of the Target 12 investigators to see what they are working on. And this week we're joined by Eli Sherman. As you also are aware, he's been tracking COVID-19 data in Rhode Island since the very beginning of the pandemic. And Eli, we do want to get into some specifics, but first, why don't you bring us up to date on where things stand with the numbers in Rhode Island right now?
Sure, yeah, there's still a lot of transmission going on out there, but some key health metrics are beginning to move in the right direction. For example, I pay close attention to hospitalizations because each number represents a person who is so sick that they need professional medical attention. And as you can see from the right-hand side of this chart, the red line shows there are about 100 COVID patients in the hospital right now. The group is part of the latest wave that started around August with the Delta variant kicking up. Now, fortunately, this wave hasn't been as severe as others, and hospitalizations are now slowly coming down again, which is the trend that public health officials want to see.
All right, and Eli, it's hard to believe, but we are now less than 2 months away from hitting the 1-year mark since we first received the vaccine here in Rhode Island. So what is the data showing now? I understand we're near the top for vaccinations nationwide, right?
Yeah, about 70% of the state's 1.1 million people have been fully vaccinated since inoculation started last December. And that rate could get a boost soon because the feds just approved vaccines for 5 to 11-year-olds. But an interesting trend I'm seeing right now, Danielle, is that far more Rhode Islanders are actually getting their booster shots. That's the blue line on this chart, than people who are getting their first shot. That's the green line. And, you know, given the persistence of vaccine hesitancy and opposition right now, it'll be interesting to track how far those two lines continue to separate, especially as more people become eligible for that extra dose.
All right, Eli, you did mention the vaccine approval for 5 to 11-year-olds. So this week we did get new information about when parents may be able to start seeing this and scheduling the shots for their children.
Yeah, Governor Dan McKee said earlier this week that the state should expect to see vaccines become available for that new age group within the next few weeks. State health officials are already planning to hold special clinics for 5 to 11-year-olds, with some that could even happen in school settings to increase access, especially in some of the more densely populated parts of the state. Of course, we'll be keeping a close eye on how much of that all rolls out, especially with the holidays coming up over the next couple of months.
And for people who want to learn more about where the state stands right now with COVID-19, we do have much more, including the interactive charts that Eli works on right now on WPRI.com. So Eli, thanks for joining us.
Thanks for having me.